Hey everybody, it's Dr. Eric Balcavage, and we're back for another edition of Thyroid Thursday. And today we're talking about thyroid replacement therapy. And I got the question from a listener, for somebody who follows my material, and said, how do I know if my thyroid hormone replacement strategy is working? And so that's what we're going to spend time on this video, and I'll do a quick follow-up to this to kind of finish the explanation. But it's a really good question. It's one that I don't think a lot of physicians really get or understand completely. And I think it's one of the things that clients don't really understand. I think innately, you know, if your thyroid replacement therapy is not working, but based on what type of clinician you're going to, are you going to a clinician who just prescribes T4? Are you going to a clinician who prescribes a glandular? Are you going to a clinician who prescribes T4 and T3? Are you going to a practitioner that's prescribing T3 only? Are you going to a practitioner who's also prescribing T2? You know, depending on who you're seeing and what their drive, what their goals, what their motivation is, you may get a whole bunch of different opinions as to whether your thyroid replacement therapy is working. At the end of the day, here's the three key things you need to kind of realize to answer that question for yourself. Is my thyroid hormone replacement strategy working? And what does that mean? To me, if it's working, if you take it and you feel and function back, you're back to normal. You hear clinicians or people in this space talk about we're optimizing your physiology, but what does that really mean? If we're truly optimizing physiology, then technically we shouldn't really need thyroid hormone replacement therapy, right? Or any other hormone replacement therapy if we truly optimize their physiology. I would make the argument that if we need to take a drug or supplement on a regular basis, then we're not optimized, because in an optimal body, we don't need that stuff. All we got to do is eat well, digest well, live well, sleep well, breathe well, and we should be optimized. So let's get into this. So here's the three key things to keep in mind. How do you know if your replacement therapy strategy is working? If you're still symptomatic, it's not working optimally. It's not working appropriately. Could it make you feel better if you have limited amount of thyroid hormone in your body and you get some T4? Are you going to potentially feel better, at least in the short run? Absolutely. Absolutely. If your body is not doing a great job converting T4 to T3, and your T3 numbers and free T3 numbers are really low, and you take T3, are you going to potentially feel better in the short term? Absolutely, you might feel better. Does that mean you've optimized your physiology? No, you've just put in a medication to replace a hormone, and your doctors have done this under the assumption that your body forgot how to do it, versus that your cells and your tissues probably didn't want to do it, okay? So it doesn't really matter. If you take some thyroid hormone replacement strategy, many times we find that it works initially. We find that when it starts to plateau, because you haven't actually addressed the real issue, and you take more, sometimes that makes you feel better. But there's a certain point where you're taking so much that you have both hypothyroid symptoms and hyperthyroid symptoms, and you just feel awful. So if you're still symptomatic, I don't care what type of medication, T4, T3, glandular, T4, T3 as separate medications, T3 only, you've added somebody's special T2 blend. The strategy, it may be changing symptoms a little bit, but it's not working appropriately, in my opinion. The other thing we have to ask is, what story does your thyroid panel tell? And that's a complicated one too, because depending on who you go to, you're going to see what they consider the most important thyroid panel, parts of a thyroid panel. They're not very few practitioners, especially in an allopathic model, run a full thyroid panel. They typically just run what they need to assess whether their strategy works. And even in the functional medicine space, you're going to see people who, based on their philosophy, based on their strategy, are going to run numbers, and they're going to interpret them based on their philosophy, even though, and they may tell you that you're optimized. We've optimized you, but you don't feel optimized, okay? So we have to ask the question, what story does our thyroid panel tell? And then the last question is, what does the rest of your what we call a comprehensive metabolic panel tell? Are your blood sugar numbers better? Are your cholesterol levels better? Are your renal markers better? Are your adrenal markers better? Are your inflammatory markers better? Is your gut markers better? Like, we should see if somebody truly optimized you, then we should see the optimization or the restoration of normal homeostatic metabolism in your body. If they've optimized you, right? Just putting more hormone, more drug into the bloodstream doesn't necessarily mean it's going to optimize your cells and tissues. It doesn't mean that it's going to restore normal physiology. I say this all the time. Cells operate in one of two modes. They're either in homeostatic regulation, low stress, homeostatic regulation. They have all the resources to do what they need to do, or they're in allostatic regulation, meaning there's some type of excessive stress response and there's an intentional down-regulation of the metabolism and an up-regulation of the immune inflammatory response, and the thermostat to determine and help shift the cell chemistry from manufacturing mode to cell defense mode is the amount of T3 inside the cell. So let's talk about the thyroid panel on today's video, because we won't have time for the rest of the story. The most important, I don't care what markers what ranges your doctors use, okay? There is one test that's really going to give you the best indication of if the thyroid hormone replacement strategy is working when we look at the thyroid panel. And the problem is it's really only useful if you're not taking thyroid, if you're taking like a T4 only medication, but if you're taking T3 kind of limits its use, because the T3 that we're looking at in the bloodstream isn't really what the cells converted. It's primarily a lot of what you're taking. So this is really the most important marker when I'm looking at labs to see if somebody's strategy is working, especially if they're on T4 only, is what's the free T3 to free T4 ratio. All of the T4 is made at the thyroid gland. Most of the T3 is made in the peripheral cells. And so what we want to know is, are the cells, whether you have a thyroid gland or don't have or you're on thyroid hormone replacement therapy, are the cells and tissues in a cell danger hypothyroid state, in this adaptive state, or is there a true hypothyroid state going on where there's just not enough thyroid hormone in the system? And that's what we want to determine. We can look at this ratio. So if the free T3 to free T4 ratio is between 0.31 and 0.34, and you're not taking thyroid replacement therapy or you're taking T4 only, then the strategy is probably appropriate, okay? If you're taking T4 therapy and your free T3 to free T4 ratio is less than 0.31, this should tell somebody who understands this ratio that this, even though there's enough T4, it doesn't matter what your T4, your free T4, your reverse T4, ultimately, if this ratio is reduced, the cells are not doing a great job converting T4 to T3. It's typically an adaptive response. And then I'll look at somebody's T4, free T4. Are they high because they're on T4 therapy? And if reverse T3 is high as well, then this is a person I typically will tell them, go back to your prescribing doctor and reduce the dose, okay? Because more is not going to help this. If somebody's in that range, then they're probably on the right dose for now. If they're above 0.34 and they're not taking thyroid hormone replacement on their T4 only, then this is a person who's probably not getting enough T4 into the body, because the cells are rapidly converting T4 to T3 because they need more T3, okay? Now, if you're taking T3 medication, you can't really use this ratio, which is a huge problem, because what you're measuring when you're looking at this ratio, that free T3 could be a big component of what you took. Now, if you're taking the same dose of T3 from blood chemistry panel to blood chemistry panel, thyroid panel to thyroid panel, you might be able to say, okay, I'm doing a better job converting it, but you can't really use this ratio. So if you're symptomatic and your free T3 to free T4 ratio is either below 0.31 or above 0.34, it's probably not working.